Welcome back to my channel, AI True Scale. This is Sirisha Ross, your host. My guest here is Emily Bernstein. 2019, Emily became her own mother's patient advocate the day she was diagnosed with brain cancer, and watched firsthand how the system designed to heal people can feel engineered to break them. She walked out of that experience with a question that wouldn't let her go. How does anyone survive this without someone in their corner? Today, Emily is the CEO and founder of Wheelhouse Health Navigation, a Rhode Island social enterprise that has eliminated more than $1 million in medical debt for the families it serves. From refugees arriving in the U.S. for the first time, Medicaid recipients, to privately insured clients rolling in billing errors and denied claims. She is board certified patient advocate, the 2024 NAHAC Advocate of the Year, and the one of the Bay Magazine's leading ladies of 2025. Today, we're talking about what happens when personal crisis becomes a profession. Emily, welcome to the show.
Thank you so much, Sirisha. It's great to be here.
So can you share your story and how did all this begin?
Absolutely. I mean, you just touched on it there. So my mom was diagnosed in I can't believe it was so long ago now, 2019, the rare brain cancer, and that involved about 6 months going between chemo treatments and rehab treatments, and then she had a stem cell transplant in 2020. So it was truly an ordeal, and I really saw, just like you said, firsthand how people who are trying to get healthy throughout this healthcare system have so much else that they have to manage that it can nearly become impossible. And it feels like the healthcare that is provided these days is not geared toward being healthy. It's so much stress, there's so much burden, there's so much fear and confusion that can come out of any healthcare journey, that you really need someone to be advocating next to you, kind of holding your hand through the process and providing a separate set of eyes so that and ears, so that you can actually follow the doctor's instructions, make sure that there's not an exorbitant cost associated with the care that you're receiving, make sure your insurance is paying what they should for your care, and all of these other elements that come into play. You really need an advocate by your side, and that's why I started my business, was to provide that service for people who didn't have, an eldest daughter that was as pushy as I am.
Yeah, that's fantastic. I think that's great that you were there for your mom and you were able to take care of her. And it's just I've been in that situation in 2022. So I was diagnosed with a brain issue as well. So it was not a cancer. It's like a very unique, I don't know, they said it's 1 in 10,000. It's called Moya disease. And the first thing is like, forget about the bills. It's about like the patient, whoever is going through, it's a shock. And for me, I was 38 years old back then, or 39. It was devastating for me. I'm like, I can't think about anything. And then the first thing I heard is from one of my friends, do you have like a good insurance? So that was the first question. And I had to go through paperwork, going through all that. And I did call everyone and I said like, hey, does this cover? And people don't tell you exactly what is covered and what is not.
To get a straight answer, yeah.
And it was so painful to go through that journey. Yeah, when I heard, before we talked, I heard that there is an advocate who can help people. That's like the first time I heard it.
Yes.
And I was like, wow. So it's you can seek help when you're like really stressed, and when you need someone in your corner, exactly how you were there for your mom. So I was able to relate when I heard the story. I was able to relate, and I was like, oh, this is the exact spot I was in.
Mm-hmm. And so many people have experiences like that. And so there are advocates that you can get through the hospital. Sometimes you might get a case manager or even through your insurance. But that's a very different experience than working with an independent advocate. So I
Right.
just want to make sure your people, your followers know we are out there. We are here to work specifically for you, as
Right.
opposed to listening to the hospital's policies, listening to the insurance company's
Right.
policies. Like if we want to go up against the hospital, I'm your girl. I hustle hospitals all day long, and you know it really is a point of principle because you have to make sure that they're not overcharging you, that they're not mischarging you. I think it's something like over 80% of hospital bills have some sort of error in them. And
Right.
so, you know, you may get a bill and it may be completely wrong.
Right.
So you just have to make sure that you're being taken care of while you focus on your health care.
Yeah, and there is no way for us to even know because
Exactly.
unless you're paying extra out of your pocket, you don't even know why they charge you so much. So it's really a good thing to even know about. Like there is an patient advocate that you
Yeah.
can reach out. So that's awesome. So at what point did helping people stop like a favor and start feeling like a calling?
Good question. So I always look at, well, I worked under a mentor for many years, and she really taught me the ropes. And the billing elements of healthcare, there's advocates that specialize in all kinds of different advocacy. So, you know, if you get diagnosed with cancer, there's people who can who can help you research, they can help you get into clinical trials. There's all kinds of advocacy out there. And the reason that billing advocacy speaks to me is I look at it like a puzzle, and I really am I'm incredible at puzzles.
Yeah.
And so you have to go out and you have to find the puzzle pieces, and then you have to put them in the right order. And it was really during COVID. I was actually working for a travel agency, which was not fun during COVID. I kept my job the whole time, but it was not enjoyable. And so I've always known that I wanted to have my own business. And I thought this is really a skill that's not only needed, not only are there a lot of people out there who do need it, but I'm really good at it. And so I started to pursue training. And like I said, I worked with a mentor and found that this skill set is something that I can really pursue professionally. And so when I had that realization, it's kind of been all gears go since then. And, you know, it's been so satisfying to help individual clients. It's been really satisfying to hold the system accountable and, you know, demand transparency and reasonable pricing for people who deserve it. So, yeah, there's a lot of nurses out there. Like I said, there's so many different kinds of advocates. There's people who come from nursing, and I think they're more inclined to do it as a favor because it's just in their nature. But, you know, when you're holding hospitals accountable, not to brag, but on Friday I actually found that I eliminated $202,000 in medical debt. I got a bill cut from $300,000 almost down to 80,000. And so
Wow.
that kind
That's
of, I mean, it was so satisfying for the client, but it's so
yeah.
satisfying too because the hospital was charging so much for these
Right.
bills. There's no way a reasonable human can afford that. So it's been a very
Yeah.
satisfying profession to follow.
Yeah, that's fantastic. Like it's is it an error on the hospital side or is it
No, well, this one, I've been working on it for about 2 years. So it
wow.
does take time. And initially it started out, the insurance denied them coverage at all because they said there was a pre-existing condition. And from there we fought that and were able to get the insurance to pay out. They only paid about $30,000 on a $300,000 bill.
Okay.
And so there basically was no coverage whatsoever from the insurance. And so from there, we basically got the hospital to look at it essentially as a self-pay balance, and we negotiated a fair and reasonable price for them.
Okay. Yeah, that's one thing I always wondered because for me it's like always I leaned on the insurance. So I heard this where you can go to the hospital and say, "Hey, I'm going to pay in
Yep.
cash."
Yep.
Is there going to be a different bill? than
Yeah.
what they send? Okay.
Sometimes it is actually more beneficial to not use your insurance, especially if you have something like a high deductible plan where you're going to be paying out of pocket anyway. I've had clients where they have a high deductible plan, and so automatically they're charged what the insurance would have paid, which
Right.
is usually negotiated significantly higher than the actual cash price of the procedure. And so
Okay.
sometimes they have a much lower ticket price for each line item if you don't have insurance involved at all. Also, usually, if you have insurance, things like financial assistance and settlement offers are usually not on the table. Sometimes you can negotiate it where they are, but those are options that are not available if you have insurance. So I actually had just another patient that they went and got out of network care. So it's not like they don't have insurance, but they were out of the network, so there was
Right.
no coverage. And she got a full write off because she was eligible for financial assistance.
Oh, okay, wonderful.
Yeah.
So another question is like for someone who's listening to this, and let's say they have 100,000 bill and they don't want to go with the insurance because just the case you described, and if they instead go with the patient advocate like you in the picture, will the 100K go down significantly where they can pay you plus the bill instead of going with insurance?
Typically, you have to say you're not going to imply your insurance at all before you get the procedure. So
Okay.
typically, you have to go in and you can ask them what's the cash price for this procedure. If you have something like a $16,000 deductible, you know you're going to have to pay at least $16,000 before your insurance kicks in. So you can
Right.
ask what's the cash price, and it may be 7,000 or something like that. So you opt to pay the 7,000 instead of using your insurance. That being said, it won't go to your deductible, and so we're getting really in the weeds. I apologize.
Right, right. No worries. I think people who are listening to this, Emily, they are going. Most of them are in that situation where they don't know what to do,
Yeah.
and the simplest or easiest way for them to do is like go with insurance because that's what they're asked to do. So
Right.
that's why I was kind of like, yeah, for someone listening, I think this is very important
Okay.
to understand.
Okay, well,
So
just stop me if I get too confusing. But yeah, if you know that you're going to have a lot of expenses, it may be worth it to put it towards your deductible so that down the line your insurance does kick in. So there's pros and cons, and of course an advocate can help you weigh all of those options before you get the procedure. If you have $100,000 bill after the procedure, I definitely would suggest hiring an advocate because there are several different options that we can take. And a lot of times, because it's my full time job and my goal is to take the stress off of you as the client's shoulders, there are things that I can push for and advocate for that take a lot of time. But it's not your concern. Like you're stressed about the bill, but you don't have to wait on hold. You don't have to have these conversations. And so that's what I do all day long. I talk to hospitals, I sing along to the hold music and take that off your plate for you.
yeah, that's awesome to know, Emily. I think this is a great service that you're providing for
Thank you.
people who are in stress and going through so much already,
Yeah.
where they need someone with that knowledge and expertise to work for them. Yeah, I think yeah, that's great. So, what's the single thing patients are most entitled to that almost nobody knows to ask for?
What are patients entitled to? I think people forget sometimes that you do pay for your insurance. We do pay monthly premiums, even if you have it through your employer and it comes out of your paycheck. You are paying a lot for your insurance. And so they need to work for you. And so if you get a denial for something that you think you should be covered for, or even something that's, I've gotten experimental treatments covered. I've gotten, sometimes, a lot of times, if you're getting a diagnosis, they call that diagnostic instead of preventative, and that's denied. So it's worth it to fight your insurance to cover you for what you deserve because again, you're a client of theirs, you're a customer,
Right.
and you should get what you're paying for.
Yeah, yeah, true.
I
I
think
think
that's really important.
yeah, true. So that's good. So you organized a health fair for refugees in 2024. What
Yeah.
did you see in that room?
Yeah, I did. In Rhode Island, so I am, like you mentioned, a certified community health worker well as a patient advocate. And in Rhode Island, for a while, community health work was actually a billable service for Medicaid. So the state paid for services provided to refugees and immigrants. And so I worked with newly arriving immigrants from all over the world, and we would help them get set up with primary care, with insurance coverage, a dentist, glasses if they needed it. We would get them kind of get the ball rolling on their healthcare journey here in the United States. And so I learned a lot about the needs of this population and what people understand, which is extreme, like very, very little. So if you think about how much confusion there is from people that have lived here your entire life, imagine not speaking the language, not knowing how to get on a bus and get to the hospital, not understanding how insurance works. So we provided this health fair, and we've actually done one annually since then as well. So we've done 3 total health fairs, and that initial one had all kinds of vendors, from preventative screenings. We did vaccinations while they were there. We did eye exams on site. We had people signing up for bus cards. We had the infectious disease clinic where people could get like TB testing, etc. that you need. And then we also had primary care physicians helping to do school exams for young children. So lots of different services all in one room. So that was really fantastic. The eye exams were really popular. So the next year we did a clinic focused solely on the eye exams, and we actually partnered with an organization here in Rhode Island that provided, if you gave them a prescription, they provide the glasses for free. So we did a clinic where they came in and did the actual eye exam on site. So you had your prescription, and then they could take that and get the free glasses, which was really cool. And then we've had other fairs that focus on benefits specifically. So signing up for Medicaid, for food stamps, for utilities assistance, because those are all things that people really, really need. And there's not necessarily really good services that can help you walk through that process. And so we were able to sit down with people and then, of course, follow up with them to make sure that the services were provided, that kind of thing. So that was really valuable. It was an incredible experience.
Yeah, that's wonderful. So you're basically providing the education that they need, especially when they're first entering after the country that they don't know any rules about. I think that's fantastic. So is there one client whose story changed how you run Wheelhouse?
You've got good questions.
Thank you.
There was one client that I worked with that went to she was inpatient for, I think, a month or so. So her bill was $120,000, and she had no insurance coverage. It was the same kind of thing. She had coverage through there are some sort of kind of scam insurances is what I call them. So they're not beholden to the Affordable Care Act, meaning they're not nationally recognized insurance plans. So she got barely any coverage for this giant bill. And then this rural hospital had so many things going on that were just wrong. Like, you're supposed to post the financial assistance policy regularly throughout the hospital. You're supposed to inform patients that it exists. You're supposed to have a written document that can be provided at any time. And they just weren't able to provide any of this information. And so because this patient, I mean, obviously she was going to have to declare bankruptcy if she had to pay this bill. It was a really eye-opening experience because so many people think, and we all grow up to think that the hospital is the last, their word is the truth, right? Like the bill that you get, you have to pay. And that one really made me see there are so many ways that the hospital can be wrong. And you can't listen to, like, you cannot accept their billing as the law.
Right.
And so it really was very interesting. We actually, I mean, that was when we threatened to get like legal action involved. Sometimes we threatened to go to the media to publish how fraudulent this place really was. And we were able to get the entire $120,000 waived. So this woman
Awesome.
did not have to declare bankruptcy. I mean, that was truly a life-changing case. And so that one has really stuck with me. We actually wrote that up into a white paper that has been kind of an example of what we are able to accomplish when you really put your mind to it. And it was an incredible win for me.
Yeah, that's wonderful. I think it's kind of like it also gave you a sense of accomplishment at the same time. Like you must have slept great that night, just thinking that, hey, you know what, a person who's almost ready to file a bankruptcy, and you pulled her out of there. I think that's like fantastic.
Yeah.
And
Yeah, it's,
I'm definitely think that it's a lot of hard work and all the expertise that you have, like known the rules and regulations and all that. But pulling something out like that is like really, really wonderful.
yeah,
So
thank you.
yeah,
My
that's
motto is the squeaky wheel gets the grease. So I like to be that
yeah.
squeaky wheel that doesn't give up. Turning over every rock to find the solution is definitely what my
Yeah, I didn't even know that you can do something like that, especially after the hospital gives you a bill. It's more like a verdict. It's you need to pay. It's like done. This is the
not
final.
true. It's not
Yeah,
true.
yeah, right. I mean, like again, people believe that a hospital is going to say what's the final bill
Exactly.
looks like. I didn't even. Yeah, that's a very eye opening
Yeah. And
thing.
even like right now, I have a client that we're debating. So the insurance has said that they're responsible for the bill, but the hospital doesn't have that on their records yet. And so we're working on getting the hospital to revise the record. But so the entire balance, which is like $23,000, the entire balance is in insurance responsibility. So there's like buckets at the hospital. So currently the patient balance is zero, but he's still getting notices that say your bill is due. We're going to send this to collections 1 month until everything you have to pay it. And so he forwards these to me, and I'm like, I promise you can ignore it because I have worked with them and they've told me that you're not going to be sent to collections. But they send out all of this information that's just false, and it's very frustrating.
Yeah, that happened to me. I mean, like immediately, first of all, when you see something like that, you will be like, "Oh, I don't want to go to collection agency
Exactly.
because my what is that? The credit score is going
Yes,
to
your credit score.
yeah,
Yeah, they use scare tactics like that to make you think you have to pay, but there are so many other ways around it. And it may even not be true. Like in this case, they're not sending him to collections because
yeah,
it's not his responsibility. So,
right,
yeah.
right. So one thing, you won NAHAC Advocate of the Year,
Yes.
2024. What did that reward actually validate?
So that was an incredible opportunity. It was at the Health Advocate Summit in Las Vegas. And so I was nominated and won the award out of all the NAC members across the country, which was pretty exciting. And they were recognizing my work with, I think every advocate strives to help people across the board, and it's hard when you run a business because we all want to help everybody, but we also have to get paid for our services in order to continue operating, right? And so we always try to make it fair, but we also need to get paid for our expertise. And so I think my ability to bill Medicaid when I was able to do that was seen as a really exciting possibility for helping those who cannot afford. I can run a business and I can still get paid without charging the client.
Okay.
And so I think that that's something all advocates strive to do. It's just a really hard thing to figure out
Right.
how to do. And so I was recognized for my work with the refugee population and and if getting creative with how we operate our businesses. And unfortunately, that billing opportunity has been there. They changed all the rules last year, so
Okay.
I'm not able to do that anymore. But I did start a nonprofit that I hope to continue that work in the future.
Okay. Okay. That's yeah, that's fantastic. Again, like, you're going to have opportunities like that in future. You just need to be creative, just like you said.
Exactly.
So what's the constraint keeping Wheelhouse from helping 10 times as many families right now?
I think the biggest constraint is just awareness. So podcasts like this really help with that. I'm just trying to get the word out that we exist. And
Yeah.
if you have a bill, our mission has always been to make sure everyone can understand, afford, and access their care. And so the cost of your care should never be a barrier to getting what you need. And if you have a bill that you can't afford, there are ways around it. And so I want to make sure everyone can hear that message loud and clear. I think, people have lawyers, people have financial advisors, people have physical trainers. I think everyone should have an advocate along there, in that suite of assistance that you have. And I would love for it to be as ubiquitous as legal or financial assistance options that are out there. And then the other thing is my time, obviously. So
Right.
I can't record podcasts on Monday afternoons while also helping to fight all of these different bills. So in order to scale, I would need a team to be helping me, which we're close to having, so I can grow gradually that way, which is really exciting. But we just need the word to get out there more.
Yeah, awesome. So how big is your team, or is it?
So I do all the advocacy work, and then I have a program manager who does all of my social media. She's applying for grants for me. We have our own podcast as well as a newsletter, things like that. So
Okay.
she does all the kind of back end things.
Okay, awesome. So where is the line between what AI should be, what AI should do in patient advocacy, and what is absolutely should not touch?
Good question. There's a lot of discussion about AI in advocacy, and I get calls weekly or emails weekly from people who are, starting this new startup that they think is going to automate the entire process, and I just shake my head because I don't think you're ever going to be
Hello,
able.
Emily.
Did
Did
it
I
stop?
lose you? Yeah, I think it stopped. It had like a yeah. Just start with the answer about the AI. Maybe I'll
Okay.
just edit it.
Okay. So AI is a huge topic in healthcare advocacy right now, and I think that there's a ton of people out there who are trying to automate the entire process or little pieces, parts of it. And I think that I may be a little bit of a Luddite, but I don't think that right now you're ever going to be able to automate the entire process. So there are pieces that I do use AI in some of my analyses. So if you have, a $70 itemized bill, you can load that in and say which line items do not have an insurance payment assigned to them, or I can upload a summary of benefits and then I can ask AI this treatment covered, those kinds of things. So I do use it to analyze large pieces of data. I think there's a lot of people that are trying to, like, where you can upload the explanation of benefits in your bill and then have AI do a comparison or something like that. And then, it'll spit out, here are 7 steps that you can take to try to mitigate your bill. And then some even go as far as I'll fax or I'll email the hospital for you, that kind of thing. And I just think there's too many nuances in that. So I think you still need a human analyzing what actually is going on, because sometimes it takes me 7 to 8 phone calls to actually figure out why this bill isn't getting paid the way it should be, or why is this bill so high. And then the process of communicating with the hospital is still a very antiquated process. I mean, there's no such thing as emailing the hospital.
Right, and getting
In
the
most
response.
cases, you have to send a fax, which is
Right.
very outdated technology. And then, there's portal messages that you can do, but who knows who reads those.
Right.
And so I have found that the only way to actually negotiate a bill is to get on the phone, call
Right.
them, and wait on hold, go through all the press one
Yeah.
menus, those kinds of things. But that's really the only successful way that you're going to be able to make progress, because you're talking to humans on the other end. And so if you're trying to use a robot
Right.
to
Right.
talk to
Yeah.
these hospitals, it's just
Right.
not going to work. So there are tools that make the process easier, but I think we're a long ways away from using AI to solve the problem entirely.
Right. I think you can probably use it as a tool, just as you
Yes.
mentioned in the analysis of what needs to be done, so you can reduce the time that you need to manually do it, but you get
Yep.
answers and you know the are they right or wrong. As soon as like you know that there is something wrong, you just go back and revise it, and yeah, so that's that way. That way you're still in the human in the loop where
Exactly.
you need to yeah wait for them and you need to communicate, and at the same time you hear the response and you go back, and again it's still a way in the future where AI can like even do that type of stuff, but again no one knows. And
Right.
again, people, when you're working with the clients, I think you people needs that human touch.
I
It's
agree. Yeah.
that's
To the
another
client, it's a huge benefit to have an actual human working on
right,
your bill, making sure, again, that squeaky wheel
right,
mentality,
yeah.
regular follow-ups, that kind of thing, that make sure that I touch every single one of my clients' accounts at least biweekly. If we're waiting for the hospital to respond to something, you have to continue to push them and push them.
Right, I agree. I totally agree. So, if a tool could take one repetitive piece of your work uh, and from off of your plate, which one would you hand over first?
So I always say the bane of my existence is, and this might sound bad, but HIPAA laws are really, really difficult. Of course, they're there for a reason, and I completely respect that. But when I'm working on behalf of a client, I always have to get added as an authorized representative at each of their providers. So if you're having an issue with your insurance covering your physical therapy appointments, I have to get added as a representative for your physical therapy, your insurance, potentially the referring physician to that physical therapy. And all of those require individualized forms that have to be signed, faxed, and then I fax it over and I call and they say, we haven't received it yet. So I have to fax it again. And it's a really, really long, obnoxious
Process.
process. And I would love for there to be like some universal process that could automate, at least the follow up, if not the actual generation and submission of the forms itself.
That's interesting. So
Yeah.
yeah, that would be
That's my wish. That's
very
been on my wish list for years. It's like it's so annoying when you call. You've already waited on hold for 45 minutes, and then they're like, "You're not an authorized representative," and I'm like, "But I am."
yeah, yeah. That's and I really hate to listen to that music. Like seriously, I
Yeah,
sometimes now I think they came up with that idea where you don't have to wait in the line,
right.
just press one and
Press
we'll
one,
give you a call back or something. I'm like, man, this is awesome. Yes, let
and
them
it
call.
usually works. I trust those, so
It
yeah, I use that a lot.
it works, but sometimes like when my phone is in silent mode, I miss that
You
call.
missed the
I'm
call.
like, damn it. Like I really want to use this service, and
Yep.
yeah, it's insane. So, one question for you is how to put this, and so how do you find your patients or your clients, or how do they find you? Is it like both ways, or it's just one way?
Yeah, so right now, most of the people that I'm getting are from word of mouth. And so I've gotten, a few articles written about me in area newspapers, that kind of thing. I've done some presentations. So I work with people all across the country though. And so there are I've had clients across the country that have referred their friends to me. I have a great network of other advocates that, like I said, they specialize in maybe cancer diagnosis or, cardiac issues. And if they have a billing issue come up, they may refer the client to me for that aspect of their care. And so it's been very word of mouth. I'm working on getting a little bit more strategic with
Right.
how I find clients, but yeah, it's been a growing process of getting the word out there and making sure that my name falls on the top of the list.
Awesome. So let's assume that your wish came true. So you're getting more and more leads, like maybe 10x or x. How are you going to manage your time?
Yeah, so at that point, I have several different contacts that are new advocates that I think would be willing and interested in coming on board. So I'd love to have kind of a bench of people that are available to take on cases. And I can, I can work with as many people as I have advocates for. So I have a caseload of about 20 people right now, and that's about as much as I can take. But as I work through cases, I can take on more people, and then I'm looking for someone actually to help me with with that HIPAA process and some of those early stage follow up with the clients. And then I would take over for kind of the more complicated billing aspects. So just managing different elements of the case and then having more people available to work. That's definitely the plan for down the line.
Yeah, that's great, Emily. I think that's the last question I had. So where can people find you? Emily, you froze again. Emily, you still there? Hey, Emily, can you hear me?
Yeah, sorry.
Hey, you froze again.
I'm sorry. You froze in the middle of, I think that's the last question I have for you.
Oh, okay, yeah. So that's the last question I had. So where can people find you?
Absolutely. So the best way to contact me is my website, which is wheelhouse-health.com. We're also on Instagram at the same thing, so you can message us there. And if you need help, feel free to send us a message through chat or email, and I get back to people pretty quickly, so feel free to reach out, and we'd be happy to help.
Yeah, so Emily, thank you. So there is a sentence last time we talked, you said, I'm going to carry with me. I did not know anyone would fight for me. I think that's what you said when I talked to you last time. Oh, you froze again.
So sorry.
No, no worries. I think good that it's not live. Okay, I'm going to repeat it so I can edit it. So Emily, thank you. There was a sentence you used last time we spoke that I going to carry with me. I did not know anyone would fight for me. That's not just the reason Wheelhouse exists. That's the reason this whole conversation matters. You have taken the most personal kind of crisis and built something that has already erased over $1 million of other people's fear. And you have done it while keeping the human at the center of the system that keeps trying to remove them. That's hard to do once you're doing it at scale. To our listeners, if any piece of what Emily said lands, a bill that feels wrong, a denial that feels final, a family member who needs a guide, go find her. Thank you, Emily, for being on the show.
Much. I really appreciate it.
Thank you.